Hi viewers, Assalamu alaikum. We are studying the dentin. It provides the bulk and general form of tooth as it is formed just before enamel, so it determines the shape of the crown, number and shape of roots, and even shape of cusp. Unlike enamel, dentin is viscoelastic and subject to slight deformation. Physical properties of dentin. It is light yellowish in color, becoming darker with age, harder than bone but softer than enamel, less darker than enamel due to less minerals, harder near center than near pulp and periphery. Primary teeth dentin is less hard than permanent. Resemble bone, but main difference is that some of the osteoblast enclosed within its matrix as osteocyte, whereas the dentin contain only the processes of the cell that form it. Cell bodies remain external to dentin. Both are considered vital because they contain living protoplasm. Hardness varies between the tooth type and between the root and crown. Figure shows the relationship between the enamel, dentin and pulp. At the top enamel, then dentino-enamel junction, then the outer mantle dentin. That tracks are shown in the pulp, the predentin, the pulp innermost, cementum and the apex. Chemical properties of dentin. Dentin contains 35% organic and 65% inorganic components. The organic substance consists of the collagenous fibrils and a ground substance of mucopolysaccharides. Type 1 collagen is principal type. Important part of the ground substance is proteoglycan chondroitin sulfate, decurin and biglycan, glycoprotein, dentin, xyloprotein, DSP. Proteins of the dentin and bone are similar, but dentin, xyloprotein and the phosphoprotein present in dentin only also contain the growth factors. The inorganic component consists of the hydroxyapatite as composed of the several thousand units. Crystals are plate-shaped thinner than plates of the enamel. Also have small amount of phosphate, carbonate and sulfates. Organic and inorganic can be separated by the decalcification or incineration. Decalcification is the process of removal of inorganic component of the tissue, like calcium ions, before fixing it. Decalcification can be done by the electrolytic decalcification. Using the mineral acid is the most common technique. Since calcium is easily soluble at a pH of 4.5, acid quickly dissolves it. The other way of separating organic and inorganic component is incineration. Incineration is the combustion of the organic substances of the tooth. Structure of odontoblast. Odontoblast is a biological cell. Origin is the neural crest. Biologically function is dentinogenesis, present at the pulpal surface, large columnar in shape, send odontoblast processes throughout dentin. Structure of odontoblast. Odontoblast is rich in endoplasmic reticulum and Golgi bodies during primary dentin formation to enhance secretory capacity. Nucleus lies away from the dentin, endoplasmic reticulum and the Golgi bodies towards the dentin. The function of odontoblast is to secrete collagen matrix for the predentin and the minerals for the dentin. Dentinal tubules. Structure that span entire thickness of dentin and formed as a result of mechanism of dentin formation. Near the pulp, tubules follow S-shaped path. Diameter of tubule is 2.5 micrometer at innermost surface, 1.5 micrometer in the middle, and 0.9 micrometer at dentino-enamel junction. Within the tubule, there is an odontoblastic process. The figure shows the dentinal tubules. Course of tubule follow gentle curve in the crown, less in the root, resemble S, called primary curvature. First convexity directed to the apex of tooth, and right angle to the dentino-enamel junction and dentino-cemental junction. Branches of tubules near terminals called the terminal branches. Here the diagram shows the surface curvature of dentinal tubules. Shows that the course of tubule follow gentle curve in the crown, less in the root, resemble S, called the primary curvature. Convexity directed to the apex of the tooth, and right angle to the dentino-enamel junction and the dentino-cemental junction. Near root tip, incisal surface tubules are straight. The ratio between the outer and the inner surface of the dentin is about 5:1. Hence, nearer to the pulp, dentinal tubules are closely packed, and outermost area of dentin is spaced apart. The ratio between the number of tubules per unit area on the pulpal and the outer surfaces of dentin is about 4:1. There are more tubules per unit area in the crown than in the root. Dentinal tubules have lateral branches throughout dentin, which are termed as canaliculi or microtubules. The cell body of the dentinal tubules are present in the lacunae, while their lateral branches are present in the canaliculi. The figure shows the enamel, then between enamel and dentin the dentino-enamel junction, and in the dentin, dentinal tubules are present, while the cell bodies of these dentinal tubules are present in the lacunae. Microtubules are 1 micrometer or less in diameter, lie at right angle to the main tubule, every 1 to 2 micrometer. Few dentinal tubules extend throughout the dentino-enamel junction into the enamel. They are termed as enamel spindles. The figure shows the orientation of the dentinal tubules in the coronal dentin and the root dentin. Coronal dentin form before the root dentin. The figure shows the lacunae in which the cell bodies of the odontoblast are present and the canaliculi in which the tubules of the odontoblast are present. Peritubular dentin, the dentin that immediately surround the dentinal tubules. It is more highly mineralized than the intertubular dentin. It is twice as thick in outer dentin, approximately 0.75 micrometer, than in inner dentin, 0.4 micrometer. By its growth, it constricts the dentinal tubules to a diameter of 1 micrometer near the dentino-enamel junction. Organic matrix is lost along with the mineral after decalcification. The calcified tubule wall has inner organic lining termed the lamina limitans, high in the glucose aminoglycans. Intertubular dentin forms the main body of dentin. It is located between the dentinal tubules, or more specifically between the zones of the peritubular dentin. Its organic matrix is retained after decalcification. About 1/2 of its volume is organic matrix, specifically collagen fibers. The fibrils range from 0.5 to 0.2 micrometer in diameter and exhibit cross-bending and 64 micrometer interval, which is typical for collagen. Figure shows the dentinal tubule surrounded by the peritubular dentin, and between the two peritubular dentin, intertubular dentin is present. The next figure shows the odontoblast processes in the dentinal tubules. The figure shows the dentin structure, the peritubular, the intratubular dentin, dentin that forms the wall of each tubule, more mineral than the intertubular dentin, and shows the intertubular dentin, dentin between the tubules. Here the figure shows the enamel and dentin. The cells of the enamel are ameloblast, while of dentin or the odontoblast shows their nucleus. Innermost is the pulp, and the predentin is also shown in the figure. Odontoblast processes. They are the cytoplasmic extension of the odontoblast. The odontoblasts reside in the peripheral pulp at the pulp predentin border, and their processes extend into the dentinal tubules. The processes are largest in the diameter near the pulp and taper further into dentin. The odontoblast cell bodies are approximately 7 micrometer in diameter and 40 micrometer in length. The figure shows the relationship between the odontoblastic processes and the dentinal tubules. Outermost structure in the figure is the dentino-enamel junction. Inner to that is the mantle dentin, then the interglobular dentin. Inner to that is the peritubular dentin, then intertubular dentin and predentin. Cell bodies of odontoblasts are shown with the nuclei inside. Nerve supply is also shown in the figure. Odontoblast processes extend into the dentin and become narrower as moving towards the dentino-enamel junction. Thank you so much for watching the video, and don't forget to subscribe the channel.